Well, welcome everyone. My name is Deb Slater, Joint Information Center Manager for Whatcom Unified Command. Thank you for coming this morning. We appreciate you being here on such short notice. You'll notice that we've configured the space for social distancing. Thank you for complying with that. There will be more information for you at the end of this briefing. I should also say that this conference is being recorded, and if you happen to be calling in or listening via the GoToMeeting, we need you to identify yourself, please. There will be two speakers and a short Q&A. Our first speaker is John Walpers.
Thank you. I am the Environmental Health Manager for the Whatcom County Health Department. Today, I am here as one of 3 incident commanders for Whatcom Unified Command for the COVID-19 response. My fellow incident commanders are Bellingham Fire Chief Bill Hewitt, representing the City of Bellingham, and Undersheriff Doug Chadwick on behalf of Whatcom County. Each of our entities have been working on the front lines for some time now in an effort to slow the spread of novel coronavirus in our community. We have been planning and preparing for the inevitability of COVID-19 in our community and are working together now to coordinate our efforts to respond not only to the spread of the virus itself, but also to the social and economic challenges we are facing in our community with schools and the businesses closed. The challenge continues. I'm saddened today to announce that just this morning, we were made aware of a second COVID-19 related death in Whatcom County. This individual was a man in his 80s who was tested before he passed away at his home on March 20th. The result for this test came back positive just this morning. We are deeply saddened by his passing. Our hearts definitely go out to the family, the friends, and loved ones of this man. Now my health department colleague, Cindy Hollinsworth, Communicable Disease and Epidemiology Manager, will provide a further update.
Cindy Hollinsworth, I'm the Communicable Disease and Epidemiology Manager at the Health Department. Today we are reporting 2 additional confirmed cases of COVID-19 in 2 residents of a skilled nursing facility. These 2 cases are in addition to 1 case announced yesterday, March 20th, in a resident at the same facility, a man in his 80s. All 3 cases are residents of Shuckson Healthcare Center in Bellingham, Washington. 1 new case is a female in her 60s, and the other new case is a female in her 70s. All residents continue to be cared for at the facility at this time. This brings the total number of confirmed cases in Whatcom County to 14 as of 9:20 this morning, Saturday, March 21st. In response, we have been working closely with staff at Shuckson Healthcare Center and consulting with infection prevention specialists at the Washington State Department of Health on providing care and testing for residents and staff. Together with Shuckson Healthcare Center, the following actions have been taken. First, all consenting residents at the facility were tested. 7 residents were tested earlier this week, including the 3 confirmed cases we've just mentioned today. An additional resident has tested negative. Test results for the other 3 individuals are still pending. 30 residents were tested yesterday by health department staff. 7 staff who work at the facility and have respiratory symptoms were tested yesterday by the health department. These individuals have also been excluded from work. Test results from the samples collected yesterday are expected in 48 to 72 hours. Secondly, staff at the facility have been taking proactive measures to protect residents and staff due to the threat of COVID-19 infection. They have also been following the orders under the governor's proclamation from March 16th. And under that proclamation, they have prohibited all visitors, screened all staff for fever and respiratory symptoms at least daily, used the recommended personal protective equipment, actively monitored all residents at least daily for possible signs of respiratory infection, put plans in place to limit resident movement and ensure residents stay at least 6 feet away from one another. This also includes increased cleaning frequency and implementation of strict infection control measures. Third, in consultation with infection prevention specialists from the Washington State Department of Health, we have been working with Shuckson Healthcare Center staff to ensure they are following best practices to provide care for ill patients while also protecting uninfected patients and those whose status is not yet known. They are continuing to isolate residents, and residents and staff will continue to be monitored frequently for symptoms. Shuckson has fully implemented the precautions outlined by DOH to prevent transmission in long-term care settings that have known COVID-19 cases. They are using droplet precautions, which protects staff and residents as we await test results. Droplet precautions mean staff are wearing masks, gloves, gowns, and eye protection. Fourth, any close contacts of the residents who tested positive will be notified. And lastly, Whatcom County Unified Command has been receiving and working to fulfill resource requests, including getting N95 masks and gloves to local healthcare providers, including Shuckson Healthcare. We really appreciate the cooperation from the staff and leadership at Shuckson Healthcare Center and the difficult work they are now doing to care for their residents. We know they are doing everything they can to protect the health of their residents, and we will continue to work with them to do so. So I'll now turn it back over to John Wolpers.
Thanks, Cindy. As you can imagine, the staff and leadership at Shuckson Health Center are working very hard to care for residents, staff, and concerned families. They were unable to be here this morning, but we have a prepared statement from them to share with you at the end of this conference. We have waited until this morning to share this news in order to give the facility time to notify families, staff, and residents. Throughout each day, we are encountering impacts on many fronts that continue to underscore the need for our community to take all actions possible. Personal protective equipment, such as masks and gloves, are in short supply and need to be prioritized for our healthcare workers on the front lines. Stay home if you're sick. If you're a person who is more vulnerable to illness, please stay at home, except to seek medical care. For everyone, we urge you to stay home as much as possible. Do not gather in groups of 10 or more. And when in groups, stay at least 6 feet away from others. It is vitally important that we all do our part to prevent the spread of COVID-19 in our community. Know that by staying home and distancing yourselves from others, you are protecting your friends and your neighbors. I'll now open the floor for questions.
Quick question, John. You around here from Harold. Do you know if the staff at this facility work at other facilities that are similar in Whatcom County?
I can answer that.
I think that would be best. I'll have Cindy answer that. She's been working closely.
So the question was, are staff working at other facilities in Whatcom County?
Yes, the staff were at Shuckson. Had they worked at other facilities
Yeah, so have any of the staff at Shuckson been working at other facilities? We just got a line list yesterday afternoon from the facility of all their staff, and that indicates which staff work at other facilities. So part of our work this morning is to contact those people and notify them of our recommendations that they not work at their other job, and to notify the other employer.
So the other employers, I'm sorry, just to make sure I'm clear, they are also, the other employers were also nursing care facilities?
We saw a variety of different types of places. So some restaurants, which would be closed now, and other types of residential living facilities.
For clarification, the second death that John spoke about, a man in his 80s, he was tested at home?
He went to his healthcare provider and was tested there and went home. And I don't know any other details other than he died in his home.
I'm sorry, he died in his home?
Yes,
So he's not the same person clearly as the 80?
that's correct. Separate from the person at the facility.
Thank you.
Yeah, no one has died at Shuckson.
Are other of these types of facilities here in Bellingham, in Whatcom County, are they under the same, I guess, protocol as Shuckson at this point? Are they testing residents? Are they and seeing any symptoms, I guess?
Yeah, so all of our facilities, really, even our retirement type living facilities, have put into place restrictions. So over the last couple of weeks and even earlier, our facilities are very used to confining residents to control disease spread, like for norovirus and flu. And so this is something they're very good at doing. And so they have been doing symptom monitoring. So we are working closely, especially with our 9 skilled nursing facilities, to talk with them about illness cluster possibilities and when people need to be tested. So working with our health officer, our public health nurses, and then the care team from the facility.
I've got another question, not related to this specific incident. We've been seeing posts on social media from a ER doctor at St. Joe's who's calling into question the protocol there, their protection of workers, of patients, visitors. Are you confident that the Peace Health St. Joseph Medical Center is taking the proper precautions at this point to prevent this from infecting folks there?
Well, I can't speak on behalf of the hospital, but we do work closely with the infection prevention team at the hospital, and we talk about what are the best practices to be put into place. I think that all of our healthcare facilities, and this is really that opportunity to emphasize that we need to save our PPE for our healthcare workers on the front lines so that they can protect themselves and those that they take care of. So if people have supplies that they have access to, they should be contacting Unified Command so they can be distributed to the places in most need.
Are you in contact with Peace Health about the procedures that they're following?
Yes, we are in contact with them about guidance documents. We work together very collaboratively with all of our healthcare partners about the CDC guidance and the State Department of Health guidance, and then how we're going to implement that here at a local level. A lot of these things are guidance, so we are still working within the framework that we have here locally as well. So when there's a shortage of PPE, that's a concern not just at the hospital, but for all of our healthcare partners.
Cindy, prior to the first case at Shuckson, were staff using PPE? Were they wearing gloves? What were they doing?
I don't have specific details about what dates they started implementing precautions for the whole facility, but I know the standard of care is for respiratory symptoms to put people in respiratory isolation. So that means staying in your room and staff who work in the room wearing protective equipment.
cases happening at Shuckson, in spite of the precautions they were taking, are you expecting more of these cases to happen, especially at these types of care facilities?
I would say, given the community spread that we know is out there, and looking at our partners in King and Snohomish, that it is highly likely that that we will see more cases in our facilities. So, you know, the staff are going home to their families and friends, and I think this just reinforces that we need to keep our circles very small, so that we can keep from contracting COVID and taking it to our workplaces. Because healthcare is essential personnel, and we need to do the best we can to protect them. So, yes, it is likely that we will have more spread.
Clarifying question, Cindy. You had mentioned, I think it was you who did this part, that yesterday 30 residents were tested by health department staff at Shuckson. You also tested 7 staff who work at the facility and have respiratory symptoms yesterday as well. Is that correct?
Yes, so the question, clarification, yeah, we tested 30 residents at the facility who had not yet been tested and agreed to testing. And then 7 staff were tested by health department staff.
And then prior to that, you had already tested 7 residents earlier this week at Shuckson. Or is that?
Yes, 7 residents had been tested between the health department and a commercial lab who was able to come to the facility.
So for the total number of residents who have been tested there so far, it's 37?
That's correct.
In terms of the staff, you said there have been 7 that had respiratory symptoms that have been tested. How many of that 7 makes up the entire staff?
I don't have the exact numbers. So the question is about, of the 7 who were tested and excluded, what's the total number of staff for the facility? I think it's somewhere around 90, but that includes housekeeping, dietary, and care staff.
So then what do we do with them? Because we know, obviously this is very infectious.
Yeah, so they're excluded from work until we get their test results back.
Okay. Not the 7, but the others who haven't been tested.
So they are working, and everybody who's in the facility wears a mask at all times, anybody who goes into the facility. And then when care is provided, staff are wearing full protective equipment. So to protect them from the residents, because we don't yet know the residents' status, because we're waiting for those test results, but also to protect the residents from the staff. So, but anybody who is symptomatic is screened for further testing.
And just kind of follow up on one of her questions. So the other staff who aren't showing symptoms,
Mm-hmm.
they're being told to not work at any other jobs that they may have, whether it's in food service or healthcare.
Yeah, that's part of our contact investigation work and discussions we'll be having with those individuals today.
Is there anything else? Is there anything you want the public to understand about what's happening? I'm sure that, people who have family at this particular center will be concerned, but so will family at other centers as well. We expected that this was happening, that this was coming. But is there anything else you want to stress?
I think, so Key's question was around what do we want to stress, knowing that this has happened in one facility and likely to come for other facilities in our county. It's a really tough time for our community, and I think we need to be prepared to circle around and provide all the support that we can from the outside, of course, but what are resources we can be providing to this facility so that they can take care of their residents the way that they need to. I think that's a really important concept, and we've already, through Unified Command Logistics, been working on some forward planning so that we can appropriately care for people in place.
One last question, Cindy. Is it known how this, how COVID got into this healthcare facility?
No, it's not known how this came into the facility. We know from our contact investigation, our case interviews and contact investigation, that this is all evidence of widespread community infection. So reinforcing the social distancing, staying home if you don't need to go out, and all the other things that John mentioned.
And just once again, the patients who have tested positive, they're being cared for at the facility, correct?
That's correct. At this point, there's been no discussion about transporting to other places or to the hospital. They're being cared for in place.
You have word on their condition?
No, not this morning. So, and not really any details other than the original respiratory symptoms that led us to test them. Yeah. Okay.
Thank you, everyone, for attending. I realize that many of you might want assets of the Shuckson Healthcare Facility. We've asked that you honor the needs of the residents and staff and try not to gain access, but we are working diligently to get you some assets, and that link will be sent out shortly after this press conference. And for other media inquiries, you can contact Claudia Murphy, whose contact info is on the media advisory that you received previously. Thanks again for attending, everyone.